I feel that I was at a critical point with my health, and I didn't know what was happening. And if I hadn't gotten the mercury taken out then, I just really don't know what would have happened. I mean, I probably would have wound up in the hospital. And so I'm just glad that, although it was kind of a grueling experience, but I'm just glad that it was taken out and that then I could begin my detox process.
That issue in my mouth with the infection up there by my tooth obviously was directly affecting my digestive system. It's just, pretty interesting that I'm feeling better now.
In 48 years of being around, and I'm going to say 38 years seeing dentists, no one has ever checked my bite. And from the moment that my bite was checked, it was discovered that my bite was off. And this is where that bite is now throwing off the alignment of my body. And it's throwing off, the functions of my body.
Every now and then I would have a low-grade fever, but I'm really thankful that I came here first. The reason being that if I had gone to a primary care provider, we would have focused on the gastrointestinal system, and I would have just been putting Band-Aids on a leaking boat, basically.
One of the first issues you should start to look into. Look into your water, look into your good, hopefully organic food, and look into your teeth before you do anything else or before you go to any regular doctor. Because if these things are not aligned, are not in good shape, you're wasting your time, most of your time, with a regular doctor because he looks into symptoms.
I had undergone a number of health problems, and I was trying to figure out, the doctors were pretty much useless. They just prescribe all kinds of things that would make you sicker. They were giving me Nexium for irritable bowel syndrome and stomach problems and reflux, and after narrowing down all the factors and writing down food diets and seeing, and it got me to thinking, oh well, it could actually just be the temperature of the food. The heat from my food was making the mercury evaporate, and maybe it's not, you could write everything down and sometimes it's something completely different.
Never had such a thorough exam before. I mean, digital everything, goes tooth by tooth, measures your bite, measures your gums. I mean, the exam took 3 hours. I mean, I was very satisfied.
He has given me things, like after I had the tooth pulled, he gave me some things to take, natural things, and you don't get that in a regular dentist, of course.
First thing Dr. Behm did with me is he put me in the chair, he took some goo, sample of the goo that's in my mouth, put it on a slide, put it in a microscope, and then on the screen I could see all the living bacteria and whatever those things are called in my mouth. And I thought to myself, that is not okay. It's one thing to have a piece of tooth missing, but not to have creatures that I was supporting.
I think his assessment, my wife's assessment, and mine was that had he not done that, and had that not been discovered and corrected, that I might not even be sitting here today.
And so he said, look, your mouth messed up, blah, blah. The most important thing for you is to get your mobility back. I mean, really, look, I'm going to start crying here, seriously, okay? So get your mobility back. Don't worry about your mouth. Go to these people. But Dr. Behm took the time to holistically look at my whole body and said, this is the most important thing for you now. So now the alignment, is coming back into my body, and I'm ready for the next step.
I realize now how the importance of the gums, the importance of the chewing bite, the importance of the right composites in our mouth. I realized that before it was just, you're going to the dentist, and whatever he did, that's what he did.
I feel rekindled on the subject of knowing that one can go to a dentist and actually get a good, safe, healthy product.
I had root canals, and I had about 30 years ago, they recapped my teeth, and there was mercury. They recapped it with mercury back in those days. And I knew I was playing golf and I had to quit. I made a swing and went down for my back, and you know, after I've got this all taken care of, I've been playing golf again. All that pain went away.
You know, my one doctor said, "How do you know all this information?" I said, "University of Google," you know. So I'm learning a lot more stuff about my own health, my own body, my own immune system, all the way down to the cellular level and how energy is being created. Who would have thought that somebody who's not you know, a doctor or a medical in the medical practice, when your life is on the line, you want to find answers. You want to find out the right answers to how to correct your health, and that's what I did.
Since I've been here and I've had my jaw aligned, and you know, they're careful measurements, just careful. I've never seen anything like it. I have not had to go to the chiropractor.
After I had the 4 root canals taken off of the top teeth, you know, immediately I've had allergies all my life, but I could actually breathe through my nose very clearly.
So what I appreciate about what's happened here with Dr. Behm is that we're not just trying to get a set of teeth in here. We're really trying to open these joints so I have good blood flow. We're thinking about my overall health and how these procedures contributes.
But getting this thing out of my mouth and getting this like poison out of my body that was affecting me handled the situation that doctors had told me could be cancer, could be leukemia, could be a whole bunch of other things. They wanted me to go through a whole bunch of tests, and the thing that worked was going to Dr. Behm and getting this out of my mouth.
You know, I wasn't just a set of teeth or coming in to get a cleaning or a filling. You know, they really cared about my whole health and me as a person. And so the assessment to the treatment was really all about my health and all of the things that made up who I am, and not just, you know, my x-rays on a screen that they wanted to take care of.
When Dr. Behm redid one of the crowns in the back of my mouth that had fallen out, underneath the crown was amalgam. Underneath the amalgam was a little bit of decay. When he cleaned that out, I had congestion totally gone. So, I mean, what the heck? What am I going to say? Do I not believe in this? I mean, what do I not think this is the future of dentistry? How could you not believe it? I mean, seriously. Those are my personal examples. Okay.